Hi guys, it's Dr. Pryor, and today my video is about ALS, which is Amyotrophic Lateral Sclerosis. In other countries it's called MND, which is motor neuron disease, and in the USA sometimes it's called Lou Gehrig's disease because he was a famous baseball player that died at a young age with ALS and was very public about it. So what I want to talk about is some things that I've learned. If you have not seen my video called May is ALS Awareness Month, please go watch that and please share that with people, because the more people that understand what the early symptoms are, they'll get treatment, they'll get diagnosed earlier. And the earlier you can get diagnosed and start treatments, the better. And the reason is because as the disease progresses and the nerves die, there's little you can do to stop the nerve death once it's started, and they don't grow back in the central nervous system. Okay, they can grow back in the peripheral nervous system, but in the central nervous system, a process called gliosis happens. The astrocytes, which are cells that help support the neurons, they move into the space, so you literally can't grow the neurons back once they're dead and gone. Okay, these are long-lived cells, so they need to have constant energy and support. And one thing I learned this year, I did a paper on the mitochondria, which are your energy little organelles in the cell. You have a problem with these when you have ALS, and this problem starts even before the disease process. So basically you need to work on that. The microbiome really affects the disease onset and progression. We see that certain microbes are needed, and other microbes, when you have them, will irritate you and will cause inflammatory state, which will progress the disease much faster. So the microbiome is super important to help. Genetics testing is super important. Your children, if you have ALS, need genetic testing, and that is because if you can start lifestyle and treatments before they turn the age where their ALS is going to come on, they'll live a much healthier, longer life, because you can really focus treatment for them. Now, the other thing I want to talk about is environmental toxins. I have seen many environmental toxins affect different energy pathways in the body, and these are super important to deal with because your nerves are high energy cells, and if they can't get the energy they need, they will die. So we have to work on the energy pathways in the body and getting the environmental toxins out that affect these. So yeah, many things you need to work on if you want to live a longer life with ALS. And I don't believe that you will get many of these treatments. I do know ALS clinics do test for heavy metals now. A lot of them do, and they help you with that. But a lot of this other stuff, I don't think they test you for and give you treatments for. Really, the treatments are Radicava or Indaverone and Riluzole. Okay, that's the only FDA approved treatments right now, and I can tell you with having patients on these, they don't work, they don't stop the progression, and they don't reverse the disease process, but they do help prolong your life somewhat. Okay, but they're very expensive. Yeah, so anyways guys, please, if you've been recently diagnosed with ALS, please reach out. There's many things we can do. I love you guys, and I hate that this disease is affecting you or possibly could affect you. I really hate this disease, but I do know how. I have been perfecting my knowledge and my skills in treating it. So the more patients I can treat, the more I can learn and tailor the treatment plan. So guys, I love you. That's all this video is about. Please share this if you know anyone that could use my help. Yeah guys, I love you. Okay, please give me a thumbs up and please subscribe. I make all sorts of health topics, not just on ALS, because I am a naturopathic doctor and we learn all sorts of things. So I love you guys. Bye.